Every patient has a story, and managing diabetes, which is a chronic disease, it's not an infection we can give a pill for and resolve in a week. And so we get to know the patients over the course of their lives, and each patient has a story, and for me that is something unique about what we do.
It's great to see young people driven into the career of diabetes. And joining me now are two speakers from this morning's session to talk about the field of diabetes and how to get people involved in the path of endocrinology. Thank you so much for joining me. Why don't we start first things first. What got you to working in the field of diabetes and what inspired you?
I had my PhD in cell and molecular biology at University of Georgia. So when I finished my internal medicine residency, I started thinking of what is the most cerebral field, what could connect molecularly, and endocrinology and diabetes became the obvious choice. And then the disease burden, which I see in diabetes, made it a very natural choice for me.
That made it set the deal for you. And how about for you? What inspired you and how did you get your start?
I've always been very interested in public health and health policy. And so as I was thinking about which field I wanted, I looked at where is, as my colleague mentioned, where is the burden of disease the greatest? And if we think about diabetes, for example, 65% of adults, or 75% of adults over the age of 65 either have pre-diabetes or diabetes. And so there's an enormous public health burden, and that drew me in to the field.
Absolutely. And would you say you got some guidance along the way? Is there one particular thing that guided you?
My associate program director at Texas Tech, where I did my residency training, she was an endocrinologist and a diabetologist, and that kind of inspired me.
Wonderful. I know I'm hearing it's either personally driven or a mentor. So what was it in your case?
So I absolutely agree, and that's what we're trying to instill in our younger colleagues that we're working with over these next 2 days, is the importance of mentorship. For me, it's also, and I'm sure you agree, our patients. Every patient has a story, and managing diabetes, which is a chronic disease, it's not an infection we can give a pill for and resolve in a week. And so we get to know the patients over the course of their lives, and each patient has a story, and for me that is something unique about what we do.
How do you get young doctors into the field of studying diabetes and endocrinology? Is it a big problem? Is it a struggle to kind of inspire the younger doctors?
Unfortunately, it really is. So I'm at the University of Chicago. I'm the adult fellowship program director, so we do the recruitment. And endocrinology, unfortunately, is one of the lowest reimbursed fields in medicine. And so to put it in perspective, by doing subspecialty training after you become an internist, you actually make less in many cases than you would have if you would have practiced as an internist. But I think there's just, as I said, getting to know the patient's stories and the joy, and being in a cerebral field where we have to really think through multiple systems. Complications of diabetes range from head, strokes to your feet, and we get to think through that on a day-to-day basis. So,
well, I know it's your passion, both of you. So what would inspire, what do you think it would take to get young doctors inspired?
I'm the Associate Clerkship Director for Weill Cornell and Texas A&M. I face this challenge almost on daily basis, how to inspire, bringing them to our clinic early on, as medical students. I think that'll be instilling the desire to learn more about the disease very early on. So by the time they come into residency and they have seen enough of diabetes and are confident to take on that challenge.
If I can add just one more thing, that we try to encourage, the spectrum of diseases that we get to take care of as endocrinologists is really unique and really broad. So we do lipid and cardiovascular risk reduction, we do osteoporosis, we do transgender medicine, which is rooted in hormonal. So we get to do a lot of things, and that makes it really appealing to a lot of people, I think.
Well, I want to thank you both for your time and for being speakers here at the ADA conference. Thank you.
Thank you so much.
Absolutely. Pleasure.
ADA TV is brought to you from the American Diabetes Association's 79th Scientific Sessions. For more from the meeting, make sure to click these links and subscribe for much more from the world of medicine.